Hey y'all, it's Kevin Shakin, and I just want to take a few minutes to highlight the impact of recent legislation on Medicare prescription drug coverage. One of the key components to the Inflation Reduction Act of 2022 is the goal of reducing prescription drug costs for Medicare beneficiaries. Prior to this legislation, it's estimated that 5 million Medicare beneficiaries are having trouble paying for their medications to the point they cannot afford them, and unfortunately we see this more often than we should, having to make a decision whether or not they should take something that they may really need. So ultimately, what we want to see from this is, of course, the benefit to the beneficiary, but it really is a shock sometimes when you go from an employer coverage with maybe very good drug coverage over to Medicare, which oftentimes, unfortunately, leaves a lot to be desired. So the Inflation Reduction Act features multiple changes that are going to span over a few year period, and it's designed ultimately to address the ongoing problem, which we can probably all agree for Medicare members, folks on a fixed income in retirement, having to pay too much for drug coverage or drug costs. But this is not all going to happen right away. So there's a several year process and different steps coming in each year as part of this legislation. So I'll get to that in a moment, but for now, let's just cover what has actually changed here in 2023 as of January 1st. So the first thing is that there's a requirement now for the drug manufacturers to offer or pay, rebates to Medicare if they increase the cost of medications faster than the rate of inflation. The second big thing here with the Inflation Reduction Act in 2023 is that there's an insulin cap. So the reduction of out-of-pocket costs for covered insulin is now capped at $35 per month. And then finally, the other thing would be the vaccinations, adult vaccinations. So there's a cost sharing for certain vaccinations previously, things like the shingles vaccine. And if you've already been in this situation, then you already know it's a pretty unpleasant surprise when you had to go previously to the pharmacy to get that, and then you were paying hundreds of dollars in out-of-pocket deductible or co-pays. So that vaccination, along with some others, is now covered 100% by Medicare. So now no longer Medicare beneficiaries have to worry about that. Those sound like all pretty positive things. Starting in 2024, Part D members who reach the catastrophic coverage stage. I'm not going to get into the 4 stages of coverage. We can do that in a separate video. But currently, some of those folks have to pay a 5% co-insurance. So that 5% co-insurance will be eliminated for those who reach the catastrophic coverage stage in 2024, which will lower out-of-pocket costs for those Medicare members taking some of those most costly medications. 2025 will see a further reduction in out-of-pocket costs when Medicare implements the first ever out-of-pocket maximum on Medicare prescription drug coverage. That limit is going to be set at $2,000 in 2025. And then finally, starting in 2026 and taking place over several years into 2029 and beyond, will be the negotiation of drug prices by the federal government. This also has never happened. The Medicare has never been able to, or been allowed to, negotiate drug costs. Now, this is not going to be all drugs. They're going to start off, identifying certain groups. So, in end of 2023, we'll get a list of the first 10 drugs that Medicare will have the opportunity to negotiate, and that will then, if they, whatever they negotiate, would then go into effect in 2026. And then, 2027, there'll be another set of prescriptions and so on. So we'll see how that all plays out. We're obviously always hopeful that this is going to be in the best interest of the Medicare beneficiary, helping reduce costs. Again, we can all probably agree that pharmaceutical costs tend to get out of hand for a lot of people, especially those on Medicare. There's not a lot of relief. There are certainly different programs that manufacturers offer or other groups, and what we find is a lot of times Medicare beneficiaries are excluded from those potential savings, which is really difficult for many people. So we're hoping that this legislation does what it intends to do to help reduce costs for members. But you have to also understand and remember that the drug manufacturers, the pharmacy benefit managers, they're going to actively be working to get around this legislation to remain profitable. And so the result will, I'm sure, be continued volatility in this prescription drug market and these costs. So, our goal is to continue educating you, helping keep you abreast of what is going on, potential updates, changes, see how this legislation plays out over the next several years through all these ups and downs. So as with anything related to Medicare, but especially this Part D stuff, which is very confusing and unfortunately stressful, let me know if you have any questions whatsoever about Medicare Part D or anything Medicare related. Always here to help. Again, it's Kevin Chaikin. I wish you well, and I look forward to talking to you soon.